Each year, Compassionate Care Network, CCN, chooses to recognize an individual or organization for their outstanding humanitarian services in the medical field. CCN salutes Dr. Mona Hanna-Attisha, MD, MPH, for her courageous reporting to uncover a colossal human tragedy and an enormous government failure impacting the health and well-being of an entire American city, whose residents were mostly poor and underserved.
Melissa Mays says the ominous change in the water was particularly noticeable at bath times.
My youngest would tell me, Mom, it's yellow and it's a filmy, gross, foamy thing, and it would smell like open sewer.
What were you seeing and when were you seeing it?
Well, in late August, we were hearing that there was lead in the water. And that's when we started our research to see if that lead in the water was getting into the bodies of children. And what we found was alarming, but not surprising considering what was going on in that water without corrosion control. So we saw that, contrary to every national, state, and city trend, our lead levels were rising. And in the city of Flint, the percentage of children with lead poisoning doubled, and in some neighborhoods, it actually tripled, and it was directly correlated with where the water lead levels were the highest.
Compassionate Care Network donors raised several $1,000s for charities directly serving the immediate and long-term health needs of more than 9,000 Flint children impacted by exposure to lead-contaminated water, and delivered over 11,000 bottles of water distributed through the American Red Cross, Catholic charities, local churches, and mosques. CCN also distributed critical health and wellness supplies like hand sanitizer, baby wipes, and formula, and organized college student field trips from Chicago to Flint to do community engagement and door-to-door wellness checks for senior citizens, immigrants, and other vulnerable people with grassroots organizations like Flint Rising and Organizing for Action.
President Obama met with the mayors of Flint, Michigan at the White House today as the White House widened its response to the lead contamination.
He's appealing. He wants it declared a disaster area, and it should be. And who should know better than this governor, because he created the disaster.
CCN advocated with the U.S. Department of Health and Human Services for more health resources for the residents of Flint. We also took part in town hall meeting preparations and briefings with the offices of the Surgeon General and HHS Secretary Burwell, invited to share our observations and recommendations prior to their official visits to Flint.
So I was called an unfortunate researcher, that I was causing near hysteria, that I was splicing and dicing numbers, and that the state data was not consistent with my data. And as a scientist, as a researcher, as a professional, you double check and you triple check, and the numbers didn't lie. So, and we knew that. But when the state, with a team of like 50 epidemiologists, tells you you're wrong, you second guess yourself. But that lasted just a short period, and we regrouped and told them why, no, you were wrong. And after about a week and a half or 2 weeks, after some good conversations, they relooked at their numbers and finally said that the state's findings were consistent.
CCN continued its advocacy, partnering with leaders like Flint's Congressman Dan Kildee and Dr. Mona Hanna-Attisha for Flint to call for federal legislation to fix Flint's infrastructure and allocate funds for long-term community health and wellness programs. Dr. Mona Hanna-Attisha's findings of elevated lead levels in the blood of Flint children sent shockwaves across the nation, causing many in other parts of the country to question the safety of their water supplies and the trustworthiness of their government reports. A passionate advocate for the health and well-being of children, Dr. Mona has become their most outspoken champion, determined to bring change in a politically misguided system which allowed this modern-day human tragedy to occur by placing profits over people. We are honored to have Dr. Mona Hanna-Attisha as part of the CCN community, and we thank her for all she has done and continues to do.
Hi, this is Dr. Mona Hanna-Attisha. I'm a pediatrician here in Flint, Michigan at Hurley Children's Hospital and Michigan State University. And I so wish I could be with you here today. But as you know, the crisis in Flint, Michigan is still ongoing, and it's important for me to stay here and take care of my kids and my community. I am absolutely honored and humbled to receive this award from you today, the 2016 Ibn Sina Award for Excellence in Humanitarian Service. It means so much to me. Your organization has
been incredible in the support of the Flint water crisis. You've helped pass out water. You've helped advocate for us at the federal level. You've given money to our Flint Kids Fund. So my words of thank you cannot be enough. And this award means absolutely so much to me, especially since it is named after a prominent Arabic medieval physician. So thank you so much.